Hi everyone, my name is Diana Villamar. I am going to tell thread of transplantation of HCV infected kidneys into uninfected recipients. Definitions: kidneys from deceased donor with hepatitis C virus. Infection can be safely transplanted into uninfected recipients when a regimen of direct-acting antiviral therapies is started as early as 2 days after transplantation. Direct-acting antiviral agents, which are associated with high HCV cure rates and manageable side effects, have created the potential to substantially increase the number of kidney transplants by making HCV infected kidneys available to HCV candidates on the waiting list.
In the expander study, we transplanted 10 patients with kidneys from hepatitis C positive deceased donors and treated them simultaneously with antiviral medications for hepatitis C. We had excellent transplant outcomes in these recipients and were able to prevent long-term transmission of hepatitis C from the donor to the recipient. So we were able to successfully treat all 10 recipients and prevent long-term transmission of hepatitis C from the donor to the recipient. They also had excellent outcomes following the transplant in terms of kidney function and recovery. Currently, there are about 1,000 kidneys per year in the United States that are not utilized because the donor is hepatitis C positive and there's no appropriate recipient to place them into. They're otherwise excellent kidneys, so we hope to be able to use them in recipients that already have a long wait for a kidney transplant and treat them with the antivirals that can successfully treat hepatitis C. And so long term, we hope to transplant many more patients with hepatitis C positive kidneys along with treating them for hepatitis C to have both a successful transplant outcome and also prevent transmission of hepatitis C. We hope to take the results of the expander study and apply it to other organ groups as well, especially patients waiting for heart transplants and lung transplants. Both of these populations could benefit from a shorter waiting time. And since there are organs from hepatitis C positive donors, both hearts and lungs, that are currently discarded because there isn't an appropriate recipient to put them into, we hope that we can put these kinds of transplants into hepatitis C negative recipients, treat them with the antivirals for hepatitis C, and have successful outcomes.
Application in medicine. In a multi-center clinical trial published in the Journal of the American Society of Nephrology, MGH researchers found that each of the three renal receptors was carried of HCV would have serious side effects attributable to antiviral therapy, and that almost all maintained excellent all graft functions at 6 months. Researchers are now hopeful that transplant centers will realize these encouraging results and the opportunity they provide to increase access to high-quality organs for patients in critical need of a kidney transplant.
One day I was at work and my cell phone rang and I answered the phone and David Goldberg from UPenn was on the other side of the line.
I did get a call from Dr. Goldberg. The funny thing is, at first I thought it was like a prank call. I got on the transplant list in October 2014.
The doctors also said that if I were to find a donor and go for kidney transplant prior to dialysis, that would be the ideal situation.
I think because of my blood type, I wasn't going to see a transplant for 5+ years.
What we learned is that there are hundreds of kidneys from people with hepatitis C that are donated, but they're never used. They're literally discarded. So this study brings those kidneys to people who need it. We're doing transplants that were never done before. We're giving people hepatitis C with a transplant and then trying to cure them afterwards. So we chose people who had many years of waiting time ahead, people who were already on dialysis. And then the third piece of it is that we were really insistent on choosing people who could go through an intense informed consent process.
So once I got the material, I just read through it. I gave it to my son, my daughter, my friend, my sister, so they can all read it, so I can get their impression, their thoughts on it.
So the theory is that if I were to receive a Hep C kidney and develop Hep C myself, then they have a plan to treat me with Zepatier and be able to cure my disease.
People have to opt in to get a hepatitis C positive kidney. And so what happened at our center was that we brought these people in for multiple visits with a lot of education. After all of that and an extensive informed consent process, then we could check the box and they could get those offers.
My son looked at me and said, "Mom, this is a no-brainer." Very clear. My daughter said the same thing.
When I first enrolled and they told me that the transplant would be quick, I was actually hoping that he'll just say maybe a year or 2 years. To my surprise, he said it'll be a few weeks to few months.
Performing transplants is really just a wonderful opportunity to improve people's lives. We take care of individuals who come to us who are incredibly sick, whose lives have been devastated by end organ disease. In particular, patients with end-stage renal disease on dialysis usually can't work. It's a large burden on their families, and so the opportunity to perform a transplant successfully is incredibly meaningful because you can turn around someone's life.
When patients get transplanted, we're checking their blood to see if they have detectable hepatitis C on post-transplant day 2 or 3. One of the unknowns is, will every patient develop hepatitis C?
So I did get the disease. They told me this the day after surgery, and they started me on the medication. That Friday, it went down dramatically. I couldn't believe it. And the following week, it was completely gone.
So once they have detectable hepatitis C in their blood, we're treating them with a medication called Zepatier, which is 1 pill a day for 3 to 4 months. That is along with all of their standard post-transplant medications, which are not altered in any way. Among the general population, Zepatier cures more than 95% of people with chronic hepatitis C.
We estimate that there will be somewhere between 400 to 1,000 additional kidney transplants from hepatitis C positive donors if this trial is successful.
I'm looking forward to traveling with my grandkids, spending more time with the kids. Go back to the things that I enjoy doing.
And she was just so excited about that simple pleasure that we all take for granted, and it was so gratifying to hear that.
Now that I have energy, I can all be picking up playing tabla, the Indian drums again. I'm also a gym rat. I go to gym every day. I want to get back into that routine. So now I'm feeling confident after the transplant surgery that I'll be able to do all that.
What's been really gratifying is that with Irma and some of our earliest experiences, that they've responded to therapy right away.
They've given me my life back.
All these doctors and plus the nurses, they were phenomenal. They changed my life.
Pros and cons. Pros. Transplantation of HCV genotype 1 infected kidneys into HCV negative recipients can provide potentially excellent allograft functions with a cure of HCV infections. All recipients were cured of HCV. Cons. On 3 days after transplantation, all recipients detectable HCV RNA proteinuria developed in one patient.
Not like yesterday, the day before. Oh yeah, we do have bears up here. It reminds me of Night of the Living Dead, believe it or not. You see how the zombies are walking towards you? That's exactly what they look like coming out of dialysis. I'm not kidding. Here we go. Say hi. The concept of getting a very good kidney with small traces of the virus and then getting treated for the virus that's curable, it just makes sense to me. That's funny. It'll be there all year. I was thinking of putting it on this side. I can attach it. If they didn't have this study, I wouldn't be where I am today. So I'm extremely grateful. I mean, it's so weird.
We're giving them the opportunity to have a transplant, but we're also treating them for a new infection that they didn't have. So that's the trade-off. There's a whole pool of kidneys that we just kept looking over. It was like we had blinders to it.
And unfortunately, if the numbers keep increasing, the number of available organs that we could use might actually continue to increase as well.
Jesus applied in Ecuador. Trial of transplantation of HCV infected kidneys into uninfected recipient has not been tested in Ecuador. And conclusion. These findings offer additional evidence that the kidneys of HCV infected donors can be a valuable resource for transplantation. So far, kept in my dad organs from deceased donors infected with HCV are often discarded. Therefore, this is an important opportunity to expand the donor pool.
It is a trial that, if successful, has the chance to save a lot of lives. Right now, there are approximately 119,000 people on the National Organ Transplant wait list.
But doctors are now looking at using organs from hepatitis C positive patients for transplants. New tonight, Dave Delosier joins us from the newsroom with more on what it could all mean. Dave?
Yeah, Eric and Charlotte, every day on average, 22 people in this country die while on the organ transplant wait list. Organ donations simply come nowhere near meeting the need. If a trial looking at using hepatitis C infected organs for transplants is successful, it could very well be a game changer.
it doesn't matter what the organ is, there are more people waiting for organ donation than we have organs available.
But that could change in a big way.
The CDC estimates about 3.5 million Americans are infected with hepatitis C.
Right now, those individuals cannot donate an organ except to another hepatitis C positive patient. But a study is looking at transplanting hepatitis infected organs into uninfected patients.
I am ready to be cured.
They then treat the transplant patient with hep C drugs.
I think that it's going to happen, and I think it is a good idea.
Dr. John Rice is the section chief of hepatology with UW Health, and he works with the liver transplant program.
The new direct-acting antiviral medications are very effective. Better than 95% to 98% of people with hepatitis C will have the hepatitis C cured with the new medications.
In a trial done at the University of Pennsylvania, 10 patients received hepatitis C infected kidneys. After the treatment, all 10 are now cured. If this moves past the trial stage, perhaps the biggest challenge for patients will be paying for it. Hep C treatments can cost as much as $85,000.
And then we have to make sure we can acquire coverage, and that usually means an external payer paying for treatment of an infection that the patient otherwise would not have had. So it's a complicated problem.
Now, given the effectiveness of the hep C treatment, dealing with the high cost may be the biggest obstacle in all of this. The hepatitis C infected kidney transplants at the University of Pennsylvania have been very successful, and now they're going to start doing transplants using hepatitis C infected hearts. Now, if they can work past the financial issues, obviously this could save an awful lot of lives.
Interesting story. Dave Deloge joining us in studio. Dave, thank you.
Thank you.